Thank you very much, Joan. Thank you for the introduction and for the opportunity to talk about erectile dysfunction, which is a very important subject to both men and women. So, and why are we talking about erectile dysfunction? Because many diabetic men will find themselves with erectile difficulties. And although I'm mainly talking about men today, women with diabetes also have their own sexual issues. But for today, I'm talking about erectile dysfunction. So erectile dysfunction is just one of the male sexual disorders. So male sexual disorders include premature ejaculation, delayed ejaculation, retrograde ejaculation, which is something that many men with diabetes find that they suffer with. And what I mean by retrograde ejaculation is that when the man climaxes, none of the seminal fluid shoots out. It just flops back into the bladder and comes out the next time the man passes urine. So the man doesn't get that sensation, that whooshing sensation. And the other implication of retrograde or backwards ejaculation is fertility, because clearly you need the semen with the sperm within it to be extruded. Now, if that doesn't happen, then the man is effectively infertile, and there's certain measures that one can do to retrieve the sperm from the urine. Other sexual disorders include a lack of desire. There are also various drugs that will induce sexual dysfunction. And how we define erectile dysfunction is when it's defined specifically on the man being able to get an erection. Okay, and and if the man can't get an erection for between 75 and 100% of the time that he wants to, and it lasts for greater than 6 months, and the man is distressed by that, then that's what we would term erectile dysfunction. And 80% of the time, there's some physical or what we call organic reason for that erectile dysfunction. 20% of the time, it's some psychological problem, and then some of the time, it's both. So diabetes and erectile dysfunction, it is an unfortunate fact that at least half of men, in my experience, it's more like 3/4 of men, will develop erectile difficulties. And the longer the man has diabetes, the more likely that there will be a problem. Now, erectile dysfunction is 3 times more common in men who are diabetic compared to men who are not diabetic. And the other thing about erectile dysfunction is that it tends to occur 10 to 15 years younger in people who are diabetic compared to men who aren't diabetic. As we'll come to later, there are very many reasons why someone's erections can be impaired. But if you're diabetic, that impairment happens sooner than if you weren't diabetic. And at times, as a urologist, I would see someone presenting with erectile difficulties, and we check their blood sugar and we find it's high, and that leads to a diagnosis of diabetes. So at times it's the first presentation of their diabetes. And the other thing to mention about diabetes and erectile dysfunction, as I'll come to later, there are various things that we can do to try and induce erections in the man, going from tablets to a penile implant. And the thing about diabetes is that you're more likely to need something more invasive than taking a pill in order to get your erections.
So, Frank, thanks very much for that. So really what we're talking about with erectile dysfunction is difficulty either getting an erection or being able to maintain an erection to have sexual intercourse. And you said that people living with diabetes are more likely to develop this at a younger age and also at greater risk of developing this condition. And I think one of the things that I've noticed in people who've come to see me is that a lot of people did not recognize this as a potential complication of diabetes. Is that something that you've encountered as well?
Yes, I encounter that not infrequently. In that I'll see a man who's been referred for help with his erections, and you're taking the history, and then you find out that they've got diabetes, but they've never linked the two together.
Yeah.
They've attributed the erections to something else.
And the other really important point that you made as well was that sometimes this can be the first presentation that somebody's actually developed diabetes.
That's right.
Yeah.
Yeah, and about 12% of diabetics erectile dysfunction is a presenting symptom, and it's not as widely recognized as it should be. So many people are aware that you can have difficulties with your vision, you can have difficulty with your nerves, so pins and needles in your feet. People are aware of having heart attacks with diabetes. People are aware of maybe having a stroke and kidney issues, kidney problems. But there seems to be less awareness of erectile dysfunction.
Yeah. And I think that's such a shame because, as you're going to talk about later, there are definitely things that people can do, as we always say, to prevent it. And then definitely things that people can do to treat it. I wonder if you want to say something now about the stigma that is associated in some circles with erectile dysfunction, because I know certainly for me as a primary care healthcare provider, it would be something that people were a bit embarrassed about talking about. Is that something that you encounter, from the urological side?
Yes, it takes quite a long time before the man actually will present to us, in the hospital setting, because they're embarrassed, they're shy, they think it's just a temporary thing. Maybe they're under stress, maybe they're under strain, and that's why their erections are not doing what they're meant to be doing. So it takes a long time before men come through, and often what happens is that their partners start complaining and saying they need to get something done, and it's actually often it's the impetus, it's the push from the partner that leads the man to overcome his embarrassment and seek help.
Yeah, I've definitely experienced that as well. Somebody will say to me, "Oh, my partner said to me that I need to come and see you." And then you have to sort of ask further questions because you think you know what it might be about, but you still need to ask those questions. And it's such a shame that people feel embarrassed about this because, as we say, there are things that can be done about it, and certainly prevention is always going to be better than cure. So I'll hand back over to you, Frank.
Sure. Okay. So this is just to show you that erectile dysfunction, let alone that associated with diabetes, erectile dysfunction is a not uncommon condition anyway. So you can see between the ages of 50 and 59, 16% of men would have erectile dysfunction. And this covers all sorts, whether it's due to cardiovascular disease, whether it's due to diabetes, whether it's due to psychological factors. So, and by the age of 60 to 69, a third of men have got erectile dysfunction. So it's actually very common, not just amongst diabetic men. It's common generally, and 30% of men, this is all comers, not just diabetic men, have premature ejaculation. And it's only when detailed confidential surveys are done that you arrive at these figures. You wouldn't imagine it's as high as a third of men, between 60 and 69, because men don't talk about these things. But it's actually more common than one might imagine. Just very briefly as to how you get an erection. Essentially, to get an erection, blood has to come into the penis rapidly under high pressure and stay there. And then after intercourse, usually when the man has climaxed, the blood vessels within the penis shrink and the erection goes away. So the reason for mentioning this is that you have to have certain things have to be in place in order to get an erection. the blood flow into the penis has got to be good enough. Secondly, there's nerves to the penis that release chemicals that cause the penis to become erect. So you need a good nervous system. Also, within the penis is smooth muscle. And if you have some damage to your smooth muscle, as happens with diabetic men, again, you'll end up with erectile dysfunction. So to get an erection, you need the nerves to the penis to be working, you need the blood flow to be adequate, and you need the smooth muscles of the penis to be in working order.
And I think that illustrates how this is a complication associated with living with diabetes. And I think people would have some knowledge that with diabetes, nerves can be affected. But as we said earlier, people are used to that being perhaps with the feet. Blood vessels can be affected. So again, things like the heart attacks and strokes that you mentioned, and the muscles. Maybe that's less commonly known, but that can be affected as well by diabetes. And when you put all of those things together, you can see how erectile dysfunction can be a complication and a symptom, really, of living with diabetes. And also, the other thing is it's an important signal sometimes that your health is not as it should be, because you need, as you said, Frank, the muscles, the blood vessels, and the nerves to be functioning properly in order to be able to have that full sexual health.
Absolutely, yeah, absolutely. And the other thing just to mention briefly is that the blood stays in the penis because the drainage system is blocked when the penis is engorged. And so if you've got some problem with the veins not being able to shut off properly, then although you may be able to get an erection, you will lose it quickly because the blood just goes out through the veins. This is just another schematic to show what in the flaccid states and the erect state. In the erect state, you can see the blood vessels, the blood channels in the penis are engorged with blood. So I mentioned about you need nerves, you need blood flow, and you need the smooth muscle of the penis to be working normally. So there's various nerves that come down the spinal column and run towards the penis, which have to be intact for you to be able to get an erection. So this is just to show you some of the nerves, the pudendal nerve, and what we call the autonomic nervous system. So the basic message from this slide is that there are nerves that run in the pelvis, that run to the penis, that have to be intact and working properly to stimulate an erection. So as Joan alluded to earlier on, this is the definition of erectile dysfunction: the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. So this has been the definition of erectile dysfunction, for the past 30 years. So because this is Diabetes Africa, I just thought I'd show a black couple. And the importance of this slide, apart from being very nice looking people, is communication. When the erection's not working properly, the man gets frustrated, the partner gets frustrated, they start arguing. The partner may think that the man is up to some mischief somewhere else, mistrust, and then there's a falling out. And often by the time we see men with or without their partners, that they're at a critical point in their relationship. That could be averted if at an earlier stage there was that communication and the man says, I'm having difficulties, I think it's due to my diabetes. And the two of them can get together and help improve the situation. So communication is key.
Communication is so key as well, Frank, isn't it, with your healthcare provider? I think a lot of people would not think that that's the person that they should be going to. They might even more trust like a friend and share that information with a friend. rather than the healthcare provider. But actually, the healthcare provider has lots of ability to assist. So to look at that person's full general health, to look perhaps at their health in terms of their diabetes, and then other long-term conditions as well, because we know that other long-term conditions, high blood pressure, heart disease, they can also affect your erectile health, if I can call it that. Yep. So your healthcare provider is somebody you need to communicate with also. And just wanted to say, Frank, we really want people to not feel embarrassed, to feel free to ask questions, so to put questions in the chat. If you want to do that anonymously, you can do that just with initials as opposed to, if you don't want to put your full name in. But please don't feel embarrassed, because what we want to do is to raise awareness of this really important topic. Go on. Sorry, over to you, Frank.
Yes, no, thanks for those messages. So so see your healthcare professional, see your GP if you're having problems. Don't wait until it's so advanced. Or if you have a diabetic nurse, then also they're a very good source of information and help. So just on this slide is showing some of the factors that can cause erectile dysfunction. Certainly that you have to have the signals coming from the brain. There's something we call performance anxiety, where it hasn't worked the previous time, so the man becomes anxious that it's not going to work the next time, and that's anxiety reduces the ability to get an erection, and there's a spiral downwards. The blood supply is very important. So if you've got atherosclerosis, this is a kind of fatty deposits in your blood vessels. Typically, this is what happens in the arteries to the heart. You will get erectile difficulties. And interestingly, the diameter of the blood vessels that supply the heart are the same diameter as the blood vessels, the main blood vessels that supply the penis. So it's no wonder if you've got all this gunk in your coronary arteries causing angina or causing heart attacks, you're very likely to have the same fatty deposits in the blood flow into your penis. So they coincide. If you've had trauma in the pelvis, or you've had surgery in your pelvis, maybe some bowel issue, these are all things that can cause erectile difficulties. So as we've mentioned earlier, there are a whole variety of complications arising from diabetes, and many of these will lead directly into causing erectile dysfunction. So if you've got peripheral neuropathy, that is to say, you've got problems with the ends of your nerves, that will affect the nerves in the penis, and you'll get erectile dysfunction. Hypertension, cardiovascular disease, problems with your lipids, peripheral vascular disease, all of these things will feed into erectile difficulties. The most common reason in diabetics is some problem with the blood flow. So what we call vasculogenic erectile dysfunction. So these are some of the risk factors on the slides. If you've got some problem with the blood flow to your legs or to your heart, you will also get problems with the blood flow to your penis. High blood pressure, that affects the blood vessels. Cigarette smoking is an absolutely terrible thing. It just makes everything worse. So if you're diabetic and you smoke, you will inevitably get erectile problems. I've mentioned nerves. So these are some of so people with multiple sclerosis or alcoholics, or people who've had surgery within the pelvis, perhaps to remove the prostate, where there's damage to the nerves that go to the penis, again, will develop erectile dysfunction. And diabetes does affect the peripheral nerves. So there's certain drugs also that will cause erectile difficulties. There's pharmaceutical drugs that you can be prescribed, such as antidepressants or beta blockers or diuretics. All of these can cause erectile difficulties. Not to mention recreational drugs like cocaine, for example, cannabis users, people on heroin, methadone, and so on. So we always ask the patients, are they on any prescribed medications? Because at times, if you stop or change those prescribed medications, you may get an improvement in the erections. And we always ask them about recreational drugs, in this day and age. So stop the recreational drugs. Testosterone, you need testosterone. This is the male hormone. Women have estrogen, men have testosterone. You need reasonable levels of testosterone in order to get decent erections. And many diabetics have what's called the metabolic syndrome. One feature of that is a reduction in the testosterone. So when we see a man with erectile dysfunction, especially if he's diabetic, we will always check the testosterone levels. Because if the testosterone level is low, you can give injections to boost it, and that will help regain the erections. There's also a psychological element to this: stress, anxiety, depression, worry at work, worries at home. All of these have a negative effect on achieving an erection. And most times, by the time we see someone with erectile dysfunction, quite apart from whatever physical thing has caused it, whether it's diabetes or the blood pressure or it's the heart, there's always some psychological element to it because of how they've tried to adjust to the situation. And I mention that because at times, apart from the physical methods that we'll go through in a minute as to how to get around the erectile dysfunction, we often recommend a psychosexual counsellor to address the psychological overlay or the psychological elements that happen when a man has erectile dysfunction for whatever reason.
So Frank, you've got now here the things that we need to be looking out for. The signal that erectile dysfunction can be that your general health is not that good. So there might be an effect on your blood vessels, on your nerves. It might signify things like a low hormone level in a small percentage, I think it has to be said, of people. So, it's more likely to be the vascular element and or the nerve damage that is causing it. And you said that 80%, that accounts for about 80%, and then 20% due to psychological factors. But even when you take into consideration people who have what we've called, for want of a better word, organic reasons, that the psychological impact can have an effect on them. So you also highlighted in those slides lots of things in terms of prevention and in terms of improvement. So I saw there that you talked about smoking, and we know that can have a massive effect on things like erectile dysfunction. And I don't think people make that connection, that because the smoking damages your blood vessels, can damage your nerves as well, can have an effect on erectile dysfunction. Alcohol excess, so I'm not talking about alcohol in moderation, but alcohol excess can also have an effect. The non-prescribed drugs, I'm going to call them like that, cannabis, weed, those sorts of drugs can also have an effect as well. And I think it's really important that people look at this as better health and better general health, because these are things that we would talk about when we're talking about good general health, isn't it? And not being overweight as well. I think there is some association between being overweight and your risk of developing erectile dysfunction. Can't do anything about our age, so as you said, as we get older, there tends to be an increased risk. Can't do anything about that, but we can certainly do something about being overweight. We can certainly do something about smoking, drinking to excess, and using drugs that aren't prescribed. And with the drugs that are prescribed, again, we come back to that communication with the healthcare provider. If you start a medication and that causes erectile dysfunction, go back to your healthcare provider, discuss it with them. Don't just stop taking the medication. Please go back and discuss it with them. So, yeah, Thanks very much for that, Frank.
Yes, that's a very important point, because some of the antidepressants, if you stop them suddenly, you get you can get some serious side effects from so doing. So if your antidepressant is causing erectile dysfunction, discuss it, tail it off, try different antidepressants.